Hi, it's Dr. Felicia, and June is PTSD Awareness Month, and I want to speak about insomnia and sleep disturbances related to PTSD. It is almost 3 o'clock in the morning, and not that I'm up because of those things, I'm up because I was doing work. Um, but as I was getting ready to go to sleep, I realized, oh, there are probably people who are up who have PTSD or post trauma symptoms and are having a difficult time going to sleep and may not understand what's going on. So, sleep disturbances can be, people might say that or someone informs them that they might fight in their sleep or yell out in their sleep, almost like reenacting events in their sleep. They may not recall the dream or nightmare, but their partner or whoever shares space with them will usually share with them that, hey, you hit me, or you pushed me out the bed, or you were screaming or crying out in your sleep last night. Um, there may also be nightmares. And so these nightmares might be things that, again, the person may or may not recall. It might wake them up in the middle of the night. People also might have night sweats where they are in the trenches of a dream, if you will, or a nightmare, and they perspire to the point of soaking your clothes. So if you are a woman going through menopause, you will understand that reference. And insomnia, so difficulty going to sleep, staying asleep, or waking up earlier than you want to. And usually we say that insomnia period is if it takes you anywhere longer than 20 to 30 minutes to go to sleep, then that's what would be considered insomnia. Um, and, and again, if you wake up in the middle of the night due to a nightmare or to go to the bathroom, or because you're checking the locks or any other reason, and it takes you more than 20 or 30 minutes to go back to sleep, and then if you wake up earlier than 20 or 30 minutes before your alarm clock, that would also be insomnia. So these are some of the sleep issues that people with PTSD and post-trauma symptoms may experience. And as you can imagine, if you don't sleep well, if you're a person who experiences insomnia, if you're a person who doesn't sleep well, you know that does affect your functioning. It affects your mood, it affects your ability to, your thought processes, how well you recall things, remember, focus, concentration. So our sleep is so important to our overall functioning that it really is imperative that we get good sleep. But again, if you have PTSD and you're on high alert, or that arousal system or symptom of PTSD is in overdrive, then it can make it really difficult to go to sleep. There are some different tools that can help you sleep. There is CBT for insomnia. If you are a veteran or even a layperson, the VA has a CBTI, which is CBT for insomnia app that you can use to help you go to sleep. You can track your sleep and figure out, what might be reasons that your sleep is delayed or interfered with, whether that's because of the sleep disturbances I mentioned, or if you are maybe exercising too late, drinking too much caffeine, have worries and thoughts in your mind that are preventing you from being able to sleep. You don't have a really good sleep hygiene ritual, so that it's difficult for your body to prepare for sleep. So there are various factors that can affect your ability to get good sleep, which is so important to your functioning that it really does make sense for you to get your sleep examined or checked on and meet with the provider to help you improve your sleep, because it can be improved. And I know sometimes people think, well, I've been dealing with this for 10, 20 years it's not going to get better. The reality is that it can. I've worked with plenty of people who've had issues for plenty of years, decades even, and with consistent effort, your sleep can improve. And it's worth the effort because, again, how well you function is a large part determined on how well you sleep. So I'm about to go to sleep because I'm tired and my work is done for this, I guess, yesterday and today. And I hope that you get some good sleep. And if you would like more information, please definitely look into cognitive behavioral therapy CBTI, cognitive behavioral therapy for insomnia. And you can also access resources through the National Sleep Center. So hope that's helpful. And if you'd like more information, you can also reach out to me at Dr. Felicia Berry. I'm on most social media platforms under that tagline at Dr. Felicia Berry, as well as on my website at drfeliciaberrymitchell.com. You can reach it and find information there on sleep. Well, have a good night. Happy sleeping and rest well. Remember, if you don't take care of your mental health, you don't have health. And sleep is really important to your overall health. So hope you rest well tonight. Take care.